Welcome back to Taking Charge of My Cancer podcast, episode 67. I have a very special guest join me today, Dr. Sara Nash. Sara is a psychotherapist in private practice in Gainesville, Florida, who specializes in helping professionals and retired adults navigate complex transitions, including life-changing medical conditions such as cancer. Sara loves to support people through the emotional, relational, and existential aspects of cancer survivorship and explore how to live well amidst great uncertainty. Since her own experience with breast cancer, Sara has also expanded her practice to consult with women about their options to get flat closure or breast mount reconstruction when mastectomy surgery is indicated. So I'm super excited to have you here with me this afternoon. Thank you so much, Sara, for being here today.
Thank you. I'm delighted to be here.
That's great. So, Sara, we go back. I don't remember when you started seeing one of my colleagues, Shannon. What that was, how long ago was that?
I was diagnosed almost 3 years ago to the day. So it's powerful to be March is the month we discovered it. I was 40 years old. And yeah, just powerful. I think cancer's never quite over because there's always, we'll get into that. There's always sort of the lingering treatments and fears, but the bulk of my treatments, there was a time where that's all I did was just do treatment. And it's so wonderful to be on the other side of it where it's just not dominating my life.
That's excellent. So I think that's when I met you the first time. And then, we were talking with Shannon, and then it's like, oh my God, you are, a psychotherapist. It's like, this is such an important and crucial part of all our lives, not just cancer. It's just every one of us has issues that we can manage in a different ways. And we always rely on somebody with your professional knowledge to be able to help us to navigate. And when we have something like a diagnosis with cancer, we really make life really more difficult. So it is really, I know I'm going to be asking tons of questions, and people will really appreciate all the knowledge that you can share with us today. So tell us about your role as a psychotherapist. Like, you always planned to do this. How do you land in this field?
I was always interested in how humans navigate times of crisis. Since I was a little girl, like I was really just admired people like Anne Frank and Harriet Tubman and people who just had been in, the worst circumstances and found a way to make meaning and try to do some good, even in the midst of just tremendous suffering. So that's always, I think, been part of who I am. I decided to be a therapist after my undergrad. I studied politics and just through some personal experiences went and worked with a therapist as a college student and just realized that was very helpful and very meaningful. And so I decided to do grad school for therapy and then went on to get my doctorate. I've been counseling people for 20 years, just kind of immediately gravitated towards the crisis, trauma, suicide, like the really hard stuff. And I think what that taught me right away entering the field, even as such a young person, was our capacity as human beings to really face just the most unimaginable difficulty and grow from it. Like, not to say it's easy or we want it or it's fair or any of that, but just our capacity to survive and even grow from the worst things that happen to us. And that's really been, kind of a guiding light for me all these years of sitting with all kinds of people.
Wow, I can imagine.
And when I yeah.
And then you were
When I
having,
was diagnosed with cancer, when I was diagnosed with cancer, it was like, oh boy, here's my chance to like try to apply all this stuff. I
yeah,
had always been afraid I would get cancer. Like I smoked when I was a stupid teenager, and I had like a couple cancer scares as a young adult on my cervix. It wasn't cancer, but I sort of had these like previews of it as a teenager. And so I just always was like, I just had this feeling I was gonna get breast cancer. And so I was curious about like, how do people deal with breast cancer? And then all of a sudden, like, oh my gosh, here's one of my, I would say, top three worst fears. Here it was. And I kind of felt like, okay, I'm gonna buckle up. And I've been training for this. And I think that that's not true of a lot of people. That's really a luxury of my profession that I had, and much probably like yourself, like if you ever, I don't know, that have
yeah,
you had have you had cancer? Are you a cancer survivor? No, but you're in training for it if it happens, right?
yeah,
Yeah, but not everybody has that window. So
yeah. So what you want to tell us a
I
little,
could talk all day. So I want to let you ask me questions. I could talk all day.
tell us,
Yeah.
how did you discover your cancer? What type of breast cancer do you have? What kind of treatments do you have?
Yeah, it's funny. It's like in the moment, all that stuff seemed so, every little detail was so important. And I have to really jog my memory now. Like, what kind of cancer what was it? So it's funny how it fades. And
Yeah,
that's hopefully a good thing
good
for
thing.
some of us if we're lucky. Yeah. But anyway, it was invasive ductal carcinoma, caught very early. So I went in for a normal routine mammogram when I was 40. I had my only child, my son. He was about 2, and I had just weaned him. And I went in for a normal, my routine mammogram, anxious because I'm just anxious about my health. And the results were normal. They called me back and said, "You're fine. Come back in a year." And I just kept having this feeling that I wasn't in the clear. I was having dreams that I had breast cancer. Uh, I didn't my my right breast, which wound up being the healthy breast, was like giving me some nerve signals and some sensation flashes. And so I just wasn't at peace with the results, and I insisted on seeing a specialist. And so about 3, 4 weeks later, to my gynecologist's credit, she said, okay, like when in doubt, check it out. And I almost canceled that appointment. I thought I was being paranoid. I thought it was overkill. I thought it was just my anxiety. So I went alone. And just that dreaded thing where they
Mhm.
call you, they take some pictures and you sit for a while and they come back in and say, we need more images. And
What did
that's,
they
and
do?
the, you
They do,
know,
did they do another
hmm?
mammogram or they do an MRI?
They did another mammogram. They brought me, the radiologist gave me an ultrasound, and she was very honest. She said, you got to get a biopsy, but I do believe this is cancer.
Wow.
Buckle up. And I'm so grateful, because it just was like, okay, here we go. Um, and we caught it early. I consider myself super lucky that it wasn't in my lymph nodes. I did need chemo. I did a year of chemo, and I did a lumpectomy first, then started chemo, and then was notified that I have a higher risk genetic mutation, and so was contemplating a preventative double mastectomy all during the 3 months of my most intense chemo treatment. And so I really got lucky to have a chance to really think about it, about how I wanted to proceed. And a lot of cancer patients don't have the luxury of time
Mhm.
to make decisions. It happens so quickly. So yeah, I think there were just a lot of things that lined up that made me actually feel kind of grateful, even during the experience. And I would say the flip side of that is living as a survivor. It is absolutely both a blessing and a curse that I think my anxiety saved my life before, because I can't live in a constant state of anxiety. I mean, I have thought that I had about 8 different kinds of cancer since, and so far I've been wrong so far, but it's just like every time there's anything, that's where I immediately go. And so I've really had to develop a lot more tools to like manage that anxiety and not let it take over.
Yeah, so that kind of lead me into my next question. If you have 3 valuable tips for patients with cancer from psychotherapist standpoint, and then from a patient cancer survivor standpoint, what will that be?
I think as a therapist, is like advice is tricky because no one ever listens to my advice. They like, unless they agree with it fundamentally. So I would say, in my own experience, and everyone is different, and I do really respect that and recognize that. But in my experience as a patient, um, it was it was really important for me to try to find the opportunities that were there. And that's not to, put it on rose-colored glasses or any of that, but just to accept the love and support that people offered me. I'm getting emotional just remembering, but like, I've always kind of identified as the caretaker and the helper, and it was very powerful to have all of a sudden, people come out of the woodwork to bring me food, and I had to really kind of lean on family to help me with my toddler when I didn't feel that well, and
Mhm.
um, accepting the help and letting people sort of carry me through,
Mhm.
stepping back from roles, responsibilities. I was really at the height of my career at the University of Florida Counseling Center. I had some huge promotion and had all these counselors. This team that I had started that I was responsible for. And I just all of a sudden had to kind of let go of all kinds of
Mhm.
things that I was used to doing. And I, so I would say for me, it was really powerful to see the opportunities to accept the love and support, and to be willing to let go, of everything that wasn't absolutely essential at that time. It that's kind of Those were my North Stars to get through treatment. And I I will also add a fourth one that personally, like, if you had asked me before you're diagnosed, Sarah, like if you were ever diagnosed with cancer, like what lifestyle changes would you make? I would have said, oh, I would finally do the plant-based diet. Like I would, like all the things, right? I did not. We ordered so much pizza. It was like, I'm trying to make those adjustments now that the fog has cleared and I'm sort of back into my life again. I didn't have it. It was like I was just there to survive. I
Yep.
was there to survive, and that was enough. And it was like the first time in my life where I could step back from trying to be exceptional, trying to be successful. And so for me, there was an opportunity there to say, even with all of this difficulty, like what's still true and what's still real in my life. And so there was some beauty in it, even though it was really hard. So that was during treatment. Post treatment I was not prepared for the emotional tidal wave that hit me after I started to pick my life back up.
Mhm.
Um, And I think that's very common now that I know, like, oh, that's actually extremely, that's normal. But
Yeah.
I thought I was done with the hardest part. And I actually, being a patient was easier in a lot of ways. It was very a narrow scope of just like get through, get next thing. Okay. Manage side effects. It was just very narrow. It's different now on this side of it, living with the uncertainty. And um, I don't, what I find really helpful is, I mean, I love counseling patients and survivors because I get something out of it too. Like, we're in it together. We're
Mhm.
in this together. I'm not, you know, I'm here for you, but I'm also in it, and I can appreciate how challenging it is. And
And
so getting help.
yeah,
Yeah.
and
What were you
sorry
gonna say?
to interrupt. Yeah, that lead me into like sometimes, again, I have not been exposed to cancer myself or scare, but the day to day when I see patients, 10, 12 patients a day every day with cancer, then you kind of like I feel you guys pain, but it's never like being on your shoes. So I think that now you're saying in the beginning, well, sometimes I will say these tips, but patients won't believe it. But I think they will believe you now because you've been on their shoes now, right? So I'm talking with someone who live where I'm living, right? Versus like sometimes I feel
Got
like,
some street cred.
yeah,
Yeah.
it is like I just feel like sometimes I tell them something and I learn from you and I learn from other healthcare providers and I say, well, I listen to this podcast or I read this book and or I look at this, paper and look what it's saying. But again, I'm not in you guys' shoes to feel like what it feels to be fatigued and not wanted to do anything. And you're telling me to go and work my butt off for 150 minutes a week. And you have no idea where my body feels like. And then, but I'm pushing it. And then when I push them and they do it, they feel so much better. And I'm like, well, that was my whole point to make you realize how much better you feel right now. Hopefully that will last and then you'll continue doing it
Yes.
all along.
Yes.
But
Yes.
I think that your experience will make you a better clinician because then you really see where the patients live because you were there, you're dealing with this day to day. So I think that's an advantage. Not that you want to wish that on everyone, right? But it is definitely a way for you to learn to be a better clinician, as I'm sure a better
Oh,
person.
yes.
Yeah.
Yes, I mean, I there have both of those things I think are absolutely true. And that those have been gifts from this experience. And I just always want to say, when I say there have been gifts, like, it's also the privilege that I have that my doctors feel pretty positive about my outcomes. And it's just, that's not there. I don't believe in rose-colored glasses about cancer, about anybody's cancer. It's just can be helpful to look for what the experience can teach us.
Yep, absolutely.
Um,
So, as a breast cancer survivor, how this impact your mental health and what type of resources do you recommend or you use to yourself to help on this aspect?
yeah. I was fortunate. I was already working with my own counselor, which I've done off and on my whole adult life. I think that's a really important part of being a therapist, is that we do our own personal work. A lot, I don't want to ask my clients to do something I'm not willing to do myself. So I was lucky to be in therapy at the time of my diagnosis with an established, very trusted older male therapist who had known me for a long time. And he was just such a wonderful kind of grounding place. I continued to meet with him weekly throughout. I was really a year of treatment. And I continue to see him as needed to this day. So sometimes months go by and I don't need to talk, but it's nice to have somebody. I mean, I think having a therapist during treatment was helpful, and I absolutely needed a therapist after treatment. So the issues during treatment and after treatment can be different. Like the dust settles, the fog starts to clear, and there's almost like could be sort of a post-traumatic reaction of oh my gosh, what just happened?
Mm-hmm.
What just happened? And it for me and for the people I counsel who are impacted by cancers, like cancer intersects every aspect of your life.
Mm-hmm.
It affected my marriage, my parenting, my career, my finances, my social network, my identity, my self-worth, my sexual health and functioning, my appearance. It affected everything.
Mm-hmm.
And I didn't even know how much it was affecting until also some of the fog started to clear.
Mm-hmm.
And then it's so yeah, I would say oftentimes people who are really at the pinnacle, like the worst of the treatment, may not have the energy to get a therapist. They're just trying to survive, but it can be, especially sort of as you're emerging, that can be a really important time to reach out to talk to somebody. And you know, I'm not really a group person. I'm pretty introverted. So for me, like the recommendations to join a support group just didn't feel personally right for me. But lots of people swear by that kind of thing. So that it can be nice. You know, and I, you know, in the lead up to my double mastectomy, I took, I don't know what it was. I took like an anti-anxiety medication, Klonopin or Xan. I don't even remember what it was, but it was like, I also used some psychiatric support to get me through just the worst of it. I took a sleep aid at night, like, you know, and so in terms of resources, I would say just not being afraid to use all the things. I got FMLA leave from my job. Like I just really I I went from being just an extremely successful and responsible employee to just sort of letting the benefits and the resources take care of me for a little while.
Yeah. Yeah.
Um,
Did you work a little bit during your treatments, or you kind of stop working, or how that worked?
I worked, and I was lucky to have very supportive colleagues who kind of allowed me to take a less significant role during treatment and kind of work on my own. I did still continue to counsel some people, and it was meaningful. I mean, it was
Yeah.
meaningful to have those connections during treatment and to still feel like I had some value,
Yeah.
but less responsibility.
Yeah. And sometimes I see that, and then you tell me from the, psychotherapist standpoint, what are your thoughts? But what I see is patients will cope better when they continue moving on their regular life as close as possible. So when they continue working, they continue doing their daily routine, whatever, playing a sport if it's possible, whatever they're doing, things go better when they just quit everything and the only thing they think is about, oh, how do I feel today? Oh, the little shoulder is hurting. Oh, I feel a little nauseous. Because when you are doing something else, you're not paying attention to that, right? You're just focusing and you're just trying to move on. And I think that's very helpful. So usually I tend to tell patients, if it's possible, try to keep things as your normal pace as you can, if you cannot because you're going through chemo and your immune system is compromised and you work in a hospital, maybe a little bit different, but if you have the opportunity to be safe through treatment for them to try to keep their as normal routine as possible, because I think that make them feel better at the end. I think that's what I see. They get much less side effects is kind of what I see. So what are your
Yeah, and there's pretty sound research on just how our mindset going into all kinds of health challenges affects how intense our symptoms are and how we respond. And so I absolutely appreciate what you're saying, that keeping things as consistent and normal as possible can be very grounding and can also just distract us from our discomfort, and give perspective too. Like you can feel like, oh my gosh, like your life can come to a screeching halt, and that may not be super helpful. At the same time, and I think this is the therapist in me, I guess I might not, like I needed a break. Cancer came into my life at a time when I was burned out. I was a new mom. I was running myself ragged, trying to impress my colleagues. And it was a kind of a toxic work environment at the time. And there were ways in which being able to just stop actually helped me personally. And so it was part of how I made meaning from, okay, this is an opportunity. And so I do think people are different, right? And so it's possible that cancer becomes kind of a turning point where we may choose to step away from some things that were really important to us. For example, it wasn't important to me personally to try to physically appear that I wasn't going through cancer treatment. I did not cover my head very often. I lived in very comfortable clothes that bordered on pajamas and went to the grocery store like that. I didn't I didn't use the bag of makeup they gave me at the hospital when I went in for my lumpectomy. Like personally for me, I did not feel that that was important. And it was really nice to be able to step away from the burden of worrying about being physically attractive all the time. I have worked with other people who that gave them a really important sense of control, to wear the wigs, to put the false eyelashes on, to appear as normal as possible. And so I just don't, I think it's such an individual kind of journey, like what we each may need from this.
Got
Does
you.
that make sense?
Yeah,
Yeah.
absolutely. And that kind of lead me into the next questions. What is your experience with breast reconstruction as a young woman?
Yeah, I love that you call me a young woman. I don't feel young
Wow.
anymore. I would say that's one thing. I'm in early menopause from treatment, and it's changed. Cancer definitely aged me. But yeah, I felt pressured to get reconstruction, and I have worked a lot with women who eh, felt pressured similarly. And I don't believe anyone on my care team was coming from a bad place. But they said things like, well, you're so young. You're too young to not have breasts anymore. And what will your husband think? And having breasts is an important part of being a woman. And nobody mentioned the option to go flat. And so I just felt the only way that I knew that flat could be an option is I had a counseling colleague that I knew from work whose reconstruction failed and made her deathly ill and was flat. And so I knew someone who was flat. I wasn't close with her, but I knew it was a thing only because I knew somebody. And so it was not presented to me as an option. And it was, when I asked about it, it was, I didn't necessarily feel supported by my medical team to choose the flat option. Unfortunately, this is a pretty systemic issue in our country and in many other countries. There is an international flat movement that is just growing, and that of women who are choosing to go flat initially or explanting their implants after having problems with breast implant illness. And so there is a growing movement, and it's becoming much more, there's a lot of advocacy going on to help medical shift sort of this kind of a pro-reconstruction bias. So the idea of just putting flat on the menu, presenting it as a viable, reasonable choice that a woman can make, in the same way that reconstruction may be a viable, reasonable choice to make. Yes, so I felt pressured. Thankfully, I knew someone, I had time to think about it. I really agonized over it. And I stumbled into some resources online of communities of women who had reconstructed and regretted it. And then women who had just gone straight to flat. And so I was able to kind of do my research and begin to educate myself and make the choice that was right for me, which was to go to get an aesthetic flat closure, and not prolong the amount of medical care that I would need for the appearance of breasts that I wouldn't be able to enjoy or feel on my, in the same way that I felt my natural breasts. So I'm very pro-choice about this, but there are significant issues around consent. Like a lot of times women are told, oh, you'll just be able to get a boob job. And, they don't necessarily understand, if it's implants, they don't understand just how the immune system may react. And if it's a flat procedure, they don't always understand just how catastrophic that can be long term for the harvest sites. And just again, when someone really understands, it's absolutely, I understand why people make the choice to reconstruct, and I have clients who choose reconstruction, and I totally support them. But I felt like there was sexism and paternalism involved in how my options were framed. And as a therapist, I thought, I counsel young women who are hearing these same messages about their bodies unrelated to cancer, and they're the ones that are developing these really tragic eating disorders. And like, the messaging I was getting from mainstream medicine was that my appearance was the most important thing. And that we are so conditioned as females already to feel that way, that like are trying to hang on to some semblance of youth and beauty as we age is important. Like we've been indoctrinated into that worldview. Like, why did the social worker give me a bag of makeup when I went in for my lumpectomy? What's the message? Right? So it's everywhere. And so when flat isn't presented as an option, we are, I think, unintentionally, as care providers, we are lending support to a woman getting reconstruction, because we haven't, you know, it's like in the absence of anyone saying like, hey, you might consider this. It's usually one and done. You're out of there. You can get back to living your life quickly. It's less risk. Yeah.
Yeah, and again, I use this not just for education, but sometimes what I hear from you guys give me an opportunity for us to be better as a healthcare system, right? So sometimes more likely I'll be bringing this to the nurse navigators and say, you know what, are we talking to patients about this? And if we are not, this is how patients can feel about it. So we may have to start talking about more, right? I mean, again, I believe that that happens more from the plastic surgery standpoint, but I think it's good for us to know that and have that feedback to them, and hopefully they will put it in the education. And it is like, any other surgery, right? Like, you can have options, and then you are, at the end of the day, you are the owner of your own body. So you decide what you want to do for what you feel like you want to do with your body. No, from like
Yes,
body.
based on your values, your priorities, not based on
Yes.
any pressure from
Yeah.
your medical team.
Yeah.
And spouses have opinions too, and there's really a lot to sort through, and it's not an easy decision. I wasn't excited to lose my breasts. It wasn't easy to make the choice to go flat. I did struggle with it, and my husband was he was lovely throughout my treatment, but he really, he shut down. He was in shock, and initially he thought I was being too aggressive to even get the double mastectomy. And so he couldn't really process the reconstruction or not. He just couldn't, he was like stuck. And so our marriage we had some difficult conversations, and ultimately it's been completely fine, but we didn't know it would be completely fine. And we certainly didn't have support, from people around us to tell us like, hey, yeah, we were worried about that too, but it's fine. Like, I still love you. I'm still attracted to you. Like,
Yeah.
I'm just glad you're here. I'm glad you're here, and I'm glad you're not having to manage, breast mound reconstruction for years afterwards. So,
yeah. What would be your recommendation from a therapist standpoint to someone who perhaps decide to go flat, or is there any other option, right? Like your friend, or like the person that that, they wanted to have breast, but they can't because complications. What is the best way to deal with that? I kind of come across a few times where I have had patients that is like, okay, well, yeah, I couldn't do it for ABC, or I'm not too sure yet because I don't want to go to any other surgery, or I don't have the time, or I don't have the money, or whatever it is. But day to day, they're sad. Day to day, they don't like when they see in the mirror. Day to day, it's hard for them to deal with it. So what is the best way to cope with that?
Yes. And whether someone gets reconstruction, doesn't, declines it, or doesn't have a choice about getting it, their breast loss is consistent across all the scenarios where there's a mastectomy involved. Even if you're getting reconstruction, you are losing your breasts. The things they give you are not your breasts. They won't function like your breasts. They won't feel like your breasts. They will come at a high price. Like, breast loss is painful. It is hard. And there's no way around it. And including reconstruction doesn't really spare us breast loss. Right? It's you're losing your breasts if you're getting a mastectomy. They're coming off, and it's okay to grieve. It's okay to struggle. And the issues that may come up around body image and self-worth are totally to be, if not expected in every case, very much normal and predictable given the culture that we live in.
Mm-hmm.
And that women need to, I would strongly encourage women who are struggling with their, with, if they're not coping well with their flat chests, to join a Facebook group like Fierce Flat Forward, which is an amazing space. It has over 14,000 women who have gone flat, and many who had started with reconstruction and reversed it. But it's a growing community of extremely supportive women, and they run the gambit of being really happy and proud and comfortable with being flat and really struggling with it. And it's okay to struggle, and it may be an opportunity with other women, with a therapist, to try to work through some of those deeper self-worth issues. We live in a culture where people don't like their bodies for all kinds of reasons.
Yep.
And that's a painful, difficult thing to cope with, and getting some professional support can be worth a lot.
Got you. What has been the painful lesson that you learned along the way?
I'm less secure and more grateful. I'm less secure. I've recently applied for life insurance. I'm in private practice. I wanted a life insurance policy in case something happens. They denied me life insurance. That was scary. So it feels like, oh, I'm a survivor. I don't have the same kind of maybe superficial confidence I used to have that I will get to have a long life. So I'm less secure. I'm more grateful for every single day that I get with my son, a normal day is so wonderful. And that hasn't stopped. Even 3 years out, I'm just a normal day where I can go to work. I can read my kid the story without feeling yucky. I can, take a walk, make a meal, enjoy the garden. It's just so wonderful.
That's great. And sometimes we don't value those things until something like that happens, right? Because we tend to just rush every day through life, and we don't stop to smell the roses, and we don't stop to look at the beautiful sky, and we don't never look at the person who is coming next to us to say good morning and how are you feeling, because nobody does that, and it's so sad, right? So it's like, man, it's like totally this one-way world that something drops here, oh, I don't care, I just gonna keep moving. So it is kind of sad that, and I think that that's one of the things that totally I used to do orthopedics for many years. And when I started doing oncology, that was one of the things that I love the most. It's just all that learning and all that empathy and all that kind of like rewarding that I get from working with patients with cancer. It's just so grateful, right? Versus like why somebody else cannot be that grateful, right? Because when you when you just have your back pain or your neck pain or something that is just temporarily and goes away, we don't appreciate that as much as when we have a disease that can kill us. So it's like, why do we have to go to that point to be able to change and be a better person, right? So it's like sad.
Yeah, it is sad. It is sad. And it's, I I'm not Buddhist, but I appreciate a lot of ideas that have come from Buddhism about mindfulness and being present. And one of the, a really big idea in Buddhism is that awareness of our mortality is the most powerful teacher that we have. And they recommend thinking about our mortality is like a stone that we carry in our pocket, and we put our hand in our pocket and we touch it and we remember we are mortal, we will die. And how does that clarify what's most important? And I think cancer patients kind of have a superpower, because whether we like it or not, there's a rock in our pocket for the rest of our lives. You know, whether we're in remission or quote cancer free, we're just closer to that truth. And it's a truth that is shared across humanity, that we just don't know how long any of us are going to have. And you know, living closer to the truth of that uncertainty. You know, and for me, I think I personally was able to choose to decline reconstruction, partly because having cancer did help me clarify what was most important to me. And to me, it wasn't trying to fight the appearance that something had happened to me.
Got you.
Yeah.
Sara, how can people find you?
Probably my website is the best way to find me. My name is not spelled with an H, so it's Sara, SARANASH.com. That's probably the best way to find me. And then I have an office in Gainesville, and I also consult with women all over the world who are trying to make reconstruction decisions.
Okay, perfect. And I will put those on the show notes as well. And you already mentioned some good resources about going flat. How about for mental health?
Oh, well, I want to throw out a couple other resources if someone's trying to make a reconstructive decision, because that's near and dear to my heart. I would strongly suggest joining the Fierce Flat Forward Facebook group. There's also a nonprofit organization that's the leader in this field called Not Putting on a Shirt. And it was founded by a woman named Kimberly Bowles, who asked to go flat. And as she was falling asleep under anesthesia, the surgeon leaned over her and said, "I'm going to leave you with skin in case you change your mind." And then she was out. And so she was denied the flat closure that she insisted on, and she has started a massive international nonprofit that has lots of surgeons on the board and is evidence-based, and they keep a directory of flat-friendly surgeons that all over the country and the world. So Not Putting on a Shirt is a great resource. Also, lots of good information about explanting if you are wondering if your implants are causing some problems. And mental health and cancer, one of the this is sad, and I think speaks to how much work needs to be done around the mental health side of cancer. There's a field called psycho-oncology that I never heard anything about in my training. And it was founded by Jimmy Holland, and she's deceased, but she really has shaped kind of the field of psycho-oncology, and she's written some lovely books about just the human side of cancer. And I think that's the name of one of her books that is just beautiful and speaks to just the shared experiences of cancer patients and their families who are navigating this. And it's not specific to breast cancer. A couple of other, I really love the author Rachel Naomi Raymond. She wrote My Grandfather's Blessings and Kitchen Table Wisdom. She was a oncologist who transitioned into being a therapist, and she mostly counsels doctors who are diagnosed with cancer. And she's written some lovely books just about how to make sense and make meaning and find the gifts in this experience. So, I'm sure there's a ton of other resources out there, but those are some of my touchstones.
Perfect, perfect. How about any podcasts that you would recommend?
There's a lot going on in the cancer space, and especially kind of the flat movement space that I'm aware of. I don't currently know of podcasts that I can recommend. That doesn't mean they aren't out
Yeah,
there.
that's okay. That's
Okay.
okay.
Yeah.
Yeah. How about from like the mental health standpoint? Any podcast?
It's funny, it's like I'm constantly listening to stuff. Um,
Again, if you can,
but
if you can,
yeah, I mean, yeah, I don't have
yeah. But if you can think of it later, you're welcome to send it to me. And then, like I said, I'll add it into the notes, so that'll be fine. Great. Is there one question you wish I will have asked you and you will have answered it to wrap up?
Do you have any burning questions?
No,
I know I've shared a lot.
yes, I think that you did amazing. I think that you really give us a really good perspective from, a psychotherapist and as well a breast cancer survivor, and then really how can, see reconstruction from a different standpoint, or like, not having that option. So I think that you gave me an amazing conversation, and I think people will totally love it. So I don't, and I really thank you for being part of this show.
Thank you for having me, and I really appreciated what your team did for me when I was recovering from surgery, and I would encourage you to, if you're allowed, to broach these conversations with your patients, because it does normalize it, and it does kind of open a door to further exploration. So thank you for everything you're doing. It was great to talk to you.
Thank you, Sara. You too. Have a great rest of the afternoon.
You too.